Okay, so quad activating test. Patient is lying supine with his hip flexed. So that's hip flex to 45 degrees and knee flex to 90. So right there, I'm going to observe the tibial tubercles. So those are right there. And I'm going to look and see if it's going backwards. So if it's going backwards, it wouldn't be a smooth line like this. It would almost go in. It would be pushed back a little bit. And then I'm going to ask him to go ahead and contract his quad and try to straighten their leg. So go ahead and contract the quad and straighten the leg. And we're just observing the quad right now, just to make sure that it's okay. So he's got a little bit of stutter in there. So you might have some junk built up in there.
Yeah.
Yeah. Okay. Slocum ALRI. Patient is lying supine with the hip flex to 45 and knee to 90. Examiner is going to internally rotate the tibia 25 degrees. So remember, we have to go, our tibia is internally rotated, so we're going to turn his foot just a little bit. So you turn his foot in. Got it? And then I'm going to make sure that the patient is relaxed, especially the hamstrings, so relax these. And then I'm going to basically do the anterior drawer test at this point. So he's got his foot turned in. And then Grace. And I'm just pulling the tibia forward on this one. Okay? And you're going to do the opposite, which is the Slocum AMRI, where I turn his foot out this way. And I pull again. Okay? Lateral pivot shift, ALRI. Patient is supine with hip to 30 to 40 and slightly abducted. So abduct is to go away, so I'm going to move Scott just out to the side a little bit. And I could probably move him down just a little bit more. Examiner grasps the lower leg and or ankle and maintains about 20 degrees of tibial internal rotations. While we're maintaining internal rotation, I'm going to apply a valgus force to the knee while slowly flexing. So remember, valgus is going to be applying pressure here because I'm trying to open up the joint here. So valgus should be the lateral side, LL, valgus, lateral. I'm trying to open. So what I'm going to do is I'm going to push out and extend, push out and extend. Okay, and then the Houston external rotation test. Patient is lying supine with the lower limbs relaxed. Examiner is going to grasp the first MT of each foot with both feet and lift them off the table. So I'm just going to go ahead and grab Scott's feet like this. So MT, metatarsal joint. I'm just going to lift him up, which is a little bit easier said than done. So we just lift Scott up like that, and we're looking for, oops, sorry, Scott.
New socks.
New socks, slippery. We're just looking for the quadriceps and seeing if there's any kind of differences on the legs when we lift up that way. Next test is McMurray. This is like the end-all be-all when it comes to meniscus tests. This is the best one to use because you'll feel the clunks, you'll feel the the creaking and stuff like that. So what we do with this one, first way, I'm going to start it with Scott's foot externally rotated. And I'm going to take it and I'm going to push his hand up, and I felt that one, and bring it down, and I felt that one. So then we're going to do the same thing. We're going to go this way and this way. Then we're going to turn Scott's foot in, do the same thing. A little bit there, and a little bit there. So you want to try to get it up in that whole motion. You probably feel it in your head.
Pops every time. It's always my right hip.
So with the McMurray, make sure that we're turning that foot in and out whenever we do that test and applying pressure on the patellar joint because that's where you really feel the clicks and the grinding and stuff like that. Bounced home test. Patient is going to lie supine on the table like so. I'm going to grasp his heels in my hand, and then I'm going to flex his knees and allow the knee to passively extend. So I'm just going to bring him up, and you're just keep an eye on his knees as you do this. Let me do it, Scott.
Sorry.
You're good. We're just making sure his knees aren't like bouncing out of position when we do this, that they're going in a nice smooth motion. So you're keeping an eye on their kneecaps. Okay. Compression test. Apley's compression test. I'm going to have Scott flip over. Good job. This is another meniscus test. Seems to be very effective. So what I'm going to do right here, I'm going to push down on Scott's heel, just like this, and I'm going to turn. I'm going to twist in that joint. So this is my compression test. So I'm twisting in there. And then distraction is you're lifting up and you're doing the same thing. Yeah. Compression and distraction are two of the easier ones to do. Wilson sign test. Go ahead and sit around or flip over. And I'm gonna have Scott with his legs, yeah, knees, with the knee flexed to 90. Go ahead and sit up. And to the end. Okay, so what I'm gonna have Scott do is internally rotate the knee and then extend his leg out. So that's the Wilson sign test, and go ahead and relax. If he's having pain, you're gonna tell him to stop where he has pain. So if we internally rotate, and like say it hurts there, you're gonna have him stop and you're gonna measure the degree at which the pain is at.
Mine is so banged up. We built a house on the turf.
Alright, Ober's test. Patient is lying on the side opposite that being tested. So let's go this way since Grace is over there. So face Grace. It always happens. Alright, so you're gonna speak towards me. And we're testing, so you're laying on the opposite side. So this is the hip I'm testing. So what I'm gonna do is I'm gonna take one hand on the pelvis here, against the patient's pelvis, and then I'm gonna rest the femur above the knee and abduct and extend the hip. So I'm gonna pull it apart and pull it back. Yeah. So same thing, we're gonna pull it up because we're abducting, and then we're pulling it backwards to extend it. You all right?
Yeah.
Okay. And then it'll passively adduct on its own. Noble's compression test. Patient is supine. There you go. With the knee flexed. Examiner is positioned lateral to the patient on the involved side. So now this is my involved side. I'm going to support the knee joint with my thumb over the femoral condyle. And I'm going to apply pressure to it while the knee is passively flexed and extended. So here's his femoral condyle on this side. So if you're on this side, it would be right here. Right there. So I'm going to put my hand right there, and I'm just going to take Scott's leg out. I'm just going to keep bending and relaxing while I've got my hand on that femoral condyle.
Would it hurt if it was?
Yeah. He would have pain there, because especially when he gets closer to 90 degrees. Patellar apprehension test. Patient is going to be supine, fully relaxed. And the examiner is going to attempt to move the patient's patella laterally as far as possible with the leg fully extended. And then I'm going to do it within 30 degrees flexion. So I'm going to try to move that patella laterally so he's relaxed. And I'm just going to push his patella over. You can see it move. Push it over as far as possible. He has no pain. We're okay. Then I'm going to put him in a little bit of flexion. Nope, not that much. Just a little bit. Relax. Let me hold your leg. There you go. I'm just going to push it over. If he had pain, he would tell me at some point in time. Medial ladder patellar glide. Patient is supine and fully relaxed with the involved knee placed on a bolster so that it is flexed to 30 degrees. We don't have a bolster, but we do have a pillow. So what I'm going to do is I'm going to put this under Scott's leg. Go ahead, relax. And
Nice pillow.
thank you. So all I'm going to do is move Scott's patella from medial to lateral. So I'm just moving his patella back and forth. There's not a whole lot of movement in this one. So don't expect his kneecap to go flying over to the
Please
side.
don't
If it
break
does,
it.
we do have a problem.
Please don't break my kneecap.
If it does, if Scott's kneecap goes flying that way, we've got a major issue. So we should be fine. Yeah. Okay, I'm going to take your bolster away. All right, the next one is Clark sign. Patient is supine with the knee in 30 degrees of flexion, so just about where we were. One hand on top of the patella and apply a gentle downward pressure. And then I'm going to ask him to contract his quad. Okay, relax. Same thing, and relax. And then I'm going to make him do it at about 60 degrees. And we're going to push and relax. And do it again. There we go. Okay, that was Clark's sign. We're almost done. I might have done the last one. No. Stutter test. Patient is sitting with his feet over the edge of the table. Up we go. I'm going to stand lateral to the involved side. I'm going to cut my hand over the patella, and I'm going to ask him to slowly extend his knee. What I'm watching for or feeling for is a stutter. I kind of mentioned that before. So his leg would come in like this, but I'm feeling for it on the patella, and right now we don't feel it. He's good. There's nothing in there. So that's good. And then the Houston Plica test, which are the last one. Patient is supine. Knee flexed to 90. Examiner internally rotates the tibia. and passively moves the patella while palpating the anterior medial capsule. So I'm gonna do this, palpate, and then I'm gonna move him out this way while palpating as well. And put him back up. Keep palpating. And seeing if I feel anything. That's it. Okay? I'll get those posted on the. Okay. The correct Lockman's test. I'm gonna put my hand here so he has a little bit of flexion. And I got my hand here. I'm gonna pull up. This is anterior Lockman's test. This one's kind of pushing down, and this one's pulling up. We're gonna do it that way. And then posterior Lockman's test, I'm gonna push down. So he shouldn't have a lot of movement in it. If he does, it's an ACL thing. And you'll see it kind of clunk when you do it. So this is your anterior drawer test. Where are you at? Anterior drawer. We're gonna sit on his foot. We're gonna grasp the poles and pull forward. Just like that, and just like that. And you can feel his fibula's outward far. Okay.
It is outward.
You can feel Scott's fibula kind of move a little bit, which is normal. Why is it so far out?
I'm weird.
Oh, it's a senior meeting. Go ahead and stop. Patient, lay still, be quiet. Are you ready? Be quiet is on the instructions. Okay, the first one is called the brush sweep wipe test. So the patient is supine with his legs extended or relaxed, which is Scott right now. I'm going to put one hand below the joint line. So this is my joint. I'm going to put one hand below on the medial side and stroke it approximately toward the patient's hip 2 to 3 times. Then I'm going to use the other hand on the lateral side, and I'm just going to move fluid around. So basically what I'm going to do here is I'm going to put it on the medial side, and I'm going towards his hip. Just watching the fluid, do it on the medial side. I'm going to go on the lateral side and do the same thing. Yeah.
But this time you're going away.
Yeah.
So inside up, outside
Yep.
down.
Yep. Inside up, outside down. Palatable patella test. Patient lies supine, and the examiner is going to milk the capsule. So I'm going to, basically it's milking. I'm going to put the proximal hand over the suprapatellar pouch and the distal hand, mainly the thumb and index finger, over the patella. And I'm going to compress the pouch with the proximal hand and then compress the patella. So basically I'm going to push down here, and then I'm going to push down there. So I'm pushing, I guess that way. So push down with this one, and then push in as well. So I'm trying to push the patella into the femur. So I'm pushing there and then pushing it. Valgus stress. Patient is supine with the involved leg close to the edge of the table. So scoot this way. Knee is in full extension. I'm going to support the medial portion of the distal tibia with one hand, and the other hand are on the lateral joint. I'm going to apply a medial force to the distal tibia. So what you do here, I'm going to hold Scott's leg like so. Probably won't go that way. And I'm going to take my hand right here on the medial joint. This hand's going to stay stationary, and I'm going to try to open up his knee joint. So I'm pushing in on that knee joint and keeping this stable. Then you're going to put him in a little bit of flexion and do the same thing. So that was valgus, full extension, valgus with 25 to 30 degrees. So then I'm going to do varus, which is going to be the opposite. Same thing. I'm going to hold Scott's leg, support it here, but now I'm going to apply my hand to this side of the joint. So I'm pushing inward, trying to open up that joint. You can see a little bit of movement there when I do it, not a whole lot. You don't want a whole lot, that's bad. Same thing. Move my hands just a little bit, support, and try to open up that joint. Use your body to brace his leg to keep it stationary, okay? So we did varus in full and 25 degrees. Lockman's test. This is the one that you're going to see a lot whenever somebody is going to do a exam if it's an ACL tear. So the patient is supine with the knee flexed to 20 degrees and hands across their chest. I don't know why I say that. That's interesting for me. I don't know if I like how they're doing this one. Okay. So Lockman's test. So I've got Scott. He doesn't need to be that far. Probably about here. Lockman's, I tend to try to put my foot, or you can, Scott's laying off. If you have a longer table, you would sit on Scott's foot. Grace, this way? No, you're fine. And so what I'm going to do here is my thumbs are on the poles of his tibia, grasping behind, and I'm pulling forward. Just like that. And then when I do the posterior Lockman, I push down this way. Okay? Anterior drawer. No. Yeah, hold on. Stop.